Okay, I'm Tyler, and this is Jessica. We're from Maple City Physical Therapy. I'm here today to do a sort of a mock neck follow-up visit with her. So just to give you a brief summary of her initial appointment with me, she came in complaining of headache and neck pain. She's been working from home. She's been using her computer a lot more lately, and she's never had neck pain or headaches before like this. But she notes that the headaches are worsening, and she's having them about 2 times a day. They're pretty intense, about 8 out of 10. Is that right, Jess?
Yep.
Okay. So I gave her some exercises to do based on my assessment with her. And we, so what I'd like to do to start, Jessica, do you feel like anything has changed since the first time I saw you?
Yeah, so I still have pain and pressure in my neck, but my headaches are better. They're not as long. They're 2 at worst at this
Okay.
point.
Okay, so 2 out of 10 pain at worst, and the headaches
Mhm.
are better. And
Yep.
you've been still doing your same stuff at your work at home? Okay,
Yep.
good. So why don't you, can you move your chair back so I can see you, and maybe move it so you're kind of sideways to me, if that works? Yep, very, very good. Maybe, yeah, that will
Okay.
work just fine. Yeah, just good. So why don't we just take a first look at your range of motion in your neck? Can you try to look all the way up for me, as high as you can? Okay, what do you feel with that, Jess?
Pain,
Pain in the
pressure.
neck or headache? Does it make your headache worse?
No, it's just in my neck.
Just in your neck. Okay,
Yeah.
because last time it was, that increased your headache pain even more. So that is good. Why don't you go ahead, go right into the exercises that I gave you, the chin tucks, right? Making sure you're keeping your shoulders back. Why don't you do 10 of them for me? Today, headache is a 2 out of 10, right, to start?
Yeah.
Okay. So let's see what happens with 10. A little pressure in the neck you're feeling too?
Yep.
Okay. So we described how it was okay to have pressure in the neck as long as the headache started to decrease, right? And that seems
Yeah.
that that's been going that way. Has the neck been intolerable pain to the point where, you had to do something different, ice it or anything like that, or has it been
I've been
okay?
using ice after a long day at work.
Okay, that's probably a good idea. Okay, so when you were taking it all the way back, um, I'm not exactly sure that you were able to get it all the way as far as I would like, and in order to really speed up the process, to really get things in motion, we like to take it to what's called end range, really forceful. So I think today what I want to do is I want to implement a little sustained holding into retraction. So I want you to sit up tall for me, and I'm just going to demonstrate to you so you can actually watch me. I'm going to take my chin back all the way, and then I'm going to apply a pressure with my hand until I feel that end pressure, and I'm going to let off. Okay, I'm going to hold it about 10 seconds. So I want you to do that for me.
Okay.
All right. Just try to keep your jaw closed on this so you don't hurt your jaw. Good. And you feel that pressure a little bit differently with that overpressure and sustaining it a little bit?
Yeah.
Okay. Yep. Let's do one more after this. Does that increase your headache? You don't have to answer me right now when you're done. I want you to think, does it increase your headache pain at all?
No.
Okay. How is the headache? Does it change location, intensity, anything?
It's a little. I mean, I just have soreness back here, but it's not
Okay.
really a headache.
So my expectation is that, once we take the pressure off of the nerve that's causing your headache, my expectation is that the neck will start to get progressively better and more mobile. But I guess what I want from you, Jess, is continue with your, sitting up with good posture, avoiding your head position down and forward. Okay, those are your aggravating positions. And I want you to, now, instead of doing your chin tucks that you were doing before, I want you to do the sustained holds. Okay, so if you did it about 5 times a day and you held the position about 10 seconds, okay, maybe do like 3 in one session. Does that make sense to you?
Yeah.
And if you did that for right now, I think what I will do is I'll assess you in about 2 days. We'll do another telehealth session here, and we'll see if anything has changed. But feel free to email me or call me if things are, if the headaches are starting to increase again. But I think we're on the right track here. Okay.
Okay. Yep, that
Sound
sounds
good to
good.
you? So we'll send an email to schedule you, and just let me know. Call me for anything. Okay.
Okay, thank you.
All right. Thanks, Jess. Bye bye.
Bye.